Hello, welcome. It is, what's the time here? 3 p.m. On Friday in Brisbane, Australia. So we're coming to you, and I know everyone's in different time zones, but it's nice to orientate to where everyone is at. We're here to talk about the solution focused stance. So my name is Laura Hawkins, and we've got Dr. Leonie White online as well. If you can't see her, she'll pop up in a minute when she starts speaking. But yeah, we're here to talk all about this stance that Leonie and I have found really important in our learning around solution focused work. It's something that we think is at the core, so we can do our skills and techniques, but the stance is the piece that we find that's quite hard to hold on to sometimes when it gets a bit wobbly in session or there's lots of problems coming at us. So we hope this will be helpful for you, that you can take some tips and tricks away that we've been thinking about. And also, we're happy to have a bit of dialogue to see where this information is landing for you as well. So, to get us started, we just want to acknowledge the lands that we are on today. So, in Australia, I am on the Turrbal lands in North Brisbane, and Leonie comes from the Yugambeh land, kind of south Brisbane. And we just want to honour the custodians of the lands that we are on today, and pay our respects to the elders past, present, and emerging. So, I'm Laura Hawkins. I am a mental health occupational therapist, which I think is why this presentation has a lot of sensory tools within it. And I'm also a clinical family therapist, and I've been working in that for about 18 years through a lot of child and youth mental health in my background. And I do a lot of teaching now, and I'm also teaching in Leonie's course, the Phoenix Family Therapy Academy. Leonie, do you want to introduce yourself?
Sure. So I'm Leonie White, and I'm a psychologist and clinical family therapist. Similar to Laura, I've spent a lot of time working in child and youth mental health services, but also working a lot with adults and just in private practice now and teaching, mixture of university, and also in my training business, Phoenix Family Therapy Academy.
Great. So today we're going to shift the focus a little bit to the therapist in the picture. We'll be asking you a few little reflective questions to have a think about you and your backpack of life and where you come from. So just take it easy with that. We're keeping it in learning zone. We don't want you to reach too deep and get a bit stuck, but we will be talking as we go along some reflective questions. So I just wanted to let you know that. And the reason we're shifting this focus to the therapist is we know that what we pay attention to grows. Elliot Connie's kind of famous words here. So, what we're thinking about is if we can pay more attention to us as therapists, our awareness of how we're showing up for our clients, our awareness of how we're using the solution focused tools grows. And then we can become better practitioners, particularly when we're met with tricky times in sessions. So when we're thinking about this therapist stance, we're thinking about that this is kind of the art of the art and science of therapy. It's sitting slightly outside the skills and the specific questions and tools that we use. And it's important for us to recognize it because we need to adapt to our client's context and what's being presented to us in our conversations, so we can remain solution focused. Your stance will directly impact on your clients. And what Elliot Connie says about this is the stance is the way you hold position in therapy. Your stance starts to influence how you're showing up in interactions. And the cool thing about it is it's something that we can have a bit of control over and adjust. If we can be more mindful of how we're standing and how we're showing up, we can make some more choices in session about how we want to be and how we want to show up to these conversations. Your stance is going to start determining your questions and what you focus on in the sessions. Sometimes our preferred stance, it might not be automatic, this solution focused stance. A lot of us, I imagine, have grown up in a bit of a medical model, a bit of problem saturated stories and looking for problems. So sometimes finding this solution focused stance can be tricky. When I was working in child and youth mental health here in Queensland, sometimes I'd be really trying hard to be solution focused and stay on track and think about strengths and resources. But then I'd enter a team meeting and it would be so problem saturated, always looking for the fix. And it was a really quick way for me to get off track then when I was in the session next, because I had that little person on my shoulder saying, I need to look for the problems and talk more about the problems. So sometimes our preferred stance of being solution focused is hard to show up. And that's what we're going to talk about today and give you some hints and tips that Leonie and I have found helpful in helping us stay on track to being solution focused. One way that we think is really important to do that is catching ourselves and understanding more about how we see the world so we can understand when we get a bit wobbly as therapists. And we know that when we can be more aware of how we show up, it makes it easier for us and it helps us be more effective as therapists. Quick note here, I just want to say that our stances are really individual. It's a lot of our use of self. It's a lot of what we are bringing, even just by walking in the room, what we're wearing, our energy, and we all have to find our own groove with it. And I know that we've been hearing a lot in this conference about the power of language and the power of thinking about that. And I think that's also really important when we're thinking about ourselves. We have to feel comfortable with the language that we're using. Otherwise, we're going to get really stuck. So I just want to side note that it's really important. Oh, hello. Hello, everyone. It's really important that we are finding our own groove and at the same time being really aware of our focus and how we're standing in our solution focused conversations. Hi, everyone. Welcome along if you're just joining us. So, Leonie and I have kind of broken this stance just down into 3 words because otherwise there's so much that we can focus on, we might get a bit lost. So, what we think is at the heart of the solution focused stance is hope, belief, and difference. And I hope those words are familiar to you if you know a bit about solution focus. But we find that these are the 3 words that we're trying to show up with in our stance when we enter these solution focused conversations. So I'm just going to go through a couple of those categories just to check we're all on the same page with these. So when we're thinking about the therapist's stance of hope, hope is so important. We know that it is one of the common factors of therapeutic change and a significant contributor to making shifts happen. When someone has hope, they are more motivated and they feel like they're going somewhere. And so we think that hope is really important. Now, for therapists, the hope we have shows up in not just our words and questions, it shows up in how we persevere. It shows up in how we keep turning up as therapists, even if things are feeling really stuck. It can be there in our questions when we're asking questions that are really future oriented and hopeful. It also shows up in our pauses. So, what I mean by that is if we've asked a question and our client is thinking, us pausing is giving a bit of hope that they're going to be able to answer the question. So there's that part of hope, but there's also pauses that we can use strategically to really highlight hope. If a client says something to us that has a glimmer of hope that we've been trying to catch, we might just slow down and pause a minute just to mark that moment. So I guess what I'm trying to say is it's not just in our questions where we're bringing hope to our stance. It's how we're showing up, communicating when our eyes light up, when we get excited, when we lean in. All of these nonverbal parts of us are part of our stance as well. And we're always searching for hope through exploring the client's strengths, resources, and ways of coping. So we think hope is one of these big pillars that we're working with. I love this so much, Stance of Hope. I've done a bit of a blog about it. So if you want to read more, it's on the Phoenix Family Therapy Academy website. I think there's also a place for us to upload resources. So I will also upload this to the resources if I work out how to do that. So our second stance, so the first part of our stance was hope. The second one is belief. And when we're talking about belief, there's lots of different things that Leonie and I were thinking about with this. So we have this belief that things can change. As we know, change is constant and certain. And it's through these changes that we find opportunities. So we always have this belief that things can change, even if the client in front of us thinks that they can't change or they're feeling really stuck. We're believing it in our stance. We have a belief in our clients, their skills and resources, their strengths, their ability to cope, their ability to get through life to this point. And we're really about empowering our clients with this through our belief in them. We have a belief in the future. We believe in the journey, and we're focusing on that hope and where we want to head. So I guess that leads us to also thinking that we have belief in the process of solution focused brief therapy. Elliot Connie talks a lot about how we have to believe what we're doing to show up in this way, in this stance to be solution focused. Because if we don't believe what we're doing, we're going to wobble so much more when it gets kind of hot in the kitchen in our conversations. And then there's also this belief in our client's truth, where we're really understanding their experiences and how they see the word. So when we say the therapist stance of belief, it's kind of capturing a whole lot of stuff in that as well. And our third pillar, so we've got hope, belief, and now the pillar of difference. So that word difference, I know that we're really familiar with when we're thinking about solution focus. But I love thinking it as a part of the stance that we're showing up with because it means that we're doing super purposeful listening. We're catching those glimmers. We're listening out for things out of the ordinary. So when the problem story is on the table, we've got our ear out listening for something a little bit differently. And Elliot, Connie, and Adam talk about once you start listening differently, your client changes and they become different. So, again, our stance of believing in difference and listening and being really purposeful in our listen shows up in this way that we stand with our clients. And we've just got some little tips there about what we might do when we're kind of thinking about difference and how we stand up with that. We might listen to different phrases that come out that show that little bit of different from the problem, such as, it wasn't always like this. I used to be so much better. And then we're going to kind of listen and actively work with some of these different alternate stories that we've got going on. You can do things like pause and kind of highlight things. And I love that skill that people do where they get the client to repeat the thing that caught the therapist's attention as a way to find that difference. And Elliot and Adam also talk about how we can do things when we're getting stuck looking for difference, where we start to remember other parts about the client. So if we're feeling really stuck in the problem with the client, we can go a bit bigger and start thinking about the client's situations and how they've got to where they are. We might even consider the client's life and the people that love them, and remembering that it takes amazing strength to get through each day. All of these little prompts for us as therapists help us move the conversation to find that difference. So I hope that summary makes sense, and I hope that kind of captures what you think as well around the solution focused stance. But we thought the words hope, belief, and difference were helpful for us to remember when we're going about our solution focused conversations. So when we're thinking about the solution focused stance, we're thinking about how it shows up. So if we're thinking about how we stand and the way we see the world, this goes through the whole journey that we go through with a client. Everything from the initial phone call, the questions we ask, the things we talk about, through to the clinical environment. I was working in a workplace once.
I'll have to check in.
They had this amazing. Oh, they had this amazing artwork that was done, but it was quite dark and gloomy. And it was really interesting because some of the clients were saying, oh gosh, when I come in and see that, like it feels pretty like depressing. We changed the artwork and instantly there was a different vibe to the place when people walked in. And we've got to be careful. We don't want to go like too like positive psychology on this, but I think it's about thinking about if we're showing up with a solution focused stance, we can think about how our environment also shows up with that stance that we want to hold on to. So we're thinking about all the things from the initial interactions, clinic environment, through to our sessions, even the way meetings start. If we're showing up with our solution focused stance, we might start meetings in a different way rather than what's the problems today. We might ask that beautiful question of what's been better since the last time we met. That's us showing up in a different way. And then all the way through to endings and paperwork. I was just in another presentation earlier with some new grads, and we were talking about the power of discharge summaries and how we can show up in different ways, highlighting strengths and resources through our paperwork as well. So our stance is not only in our conversations, it's in the whole journey we have with our clients. So, one thing that we've been thinking a lot about is how do we hold this stance and what helps us and what makes it difficult to show up with our solution focused stance. I'm going to handball over to Leonie, who's going to take us through a bit of this idea of the backpack of life.
Thanks, Laura. So I guess when Laura and I were thinking about this presentation, we were thinking as family therapists, this is something that we talk about and think about a lot, but we're not so sure if it's in the sort of broader therapy and SF community. So if you want to click over, Laura. What we mean by the backpack of life, if you haven't heard that metaphor before, is this idea that we literally all have like an invisible backpack that we carry with us through all of our life. And we also carry it with us into our solution focused sessions. And what's in our backpack can either be really helpful. You know, sometimes our lived experience gives us more ideas or empathy, but sometimes it gets in the way too. Like it might invite us to overfunction or to jump into problem solving. So, what we know is that most people aren't consciously aware of their backpack of life and what's in it. And very few people kind of stop and pause and consider that. Just flagging some additional resources here. This is on my private practice YouTube channel for people who want to kind of dive a little bit more into it. But if we flip through, Laura, I'll give you just a little bit of an overview. So, in our backpacks of life, we have our worldview. Also, it impacts our worldview. It impacts our values and beliefs about not just our life, but about therapy and being helpful. It impacts our skills and resources. And then also, it can impact how susceptible we are to anxiety. And I don't know if you guys have noticed how contagious anxiety can be if one part of the system is becoming really stressed and concerned about a client, whether that's a family member or another service. It just seems to filter through to other layers. And then how susceptible we are to that and to being pulled back into a problem focus is definitely influenced by that backpack. And then what's in it is pretty much everything. So what's come down through our intergenerational history is given to us in our backpack when we're born. And then it's all of our family of origin experiences, our family context, our culture, spirituality, our experiences at school and in our professional training. It's every supervisor or mentor that we've interacted with, all of our work experiences. This conference is now in our backpacks of life. It's our frameworks and the different places that we've had our work experience as well. So this idea that it can help or hinder us, it's really particularly relates to our stance. So we can have many strengths to draw on from a backpack of life, but there will definitely be some things that get in the way. And I was thinking this morning, I was watching a really great presentation, and I hope I'm going to say her name correctly, by Brigitte Lavoie. And she was talking about a client who was doing some things that were very hard to maintain a solution focused stance. And some of the things that didn't kind of seem okay in terms of how the parent was responding to their child. And then I was thinking, because I've worked so much with kids and families and done a lot of supervision, I know when a client reminds us of someone, maybe from our life or our experience, particularly if it's been a negative experience, that part of our backpack of life can make it even harder for us to see the positive intention and maintain that stance of hope, belief, and difference. Now, just to kind of drill down a little bit more into this backpack of life, in family therapy, we talk about vertical and horizontal kind of axes in terms of stressors. And Laura is famous throughout Australia for her jazz hands as she explains this. So I'm going to channel Laura. When we think about the vertical axis, it's everything that's handed down to us from the generation. So it's everything that kind of comes down. You might think of this as the hand we're dealt, but it's up to us to decide what to do with it. The horizontal axis is what happens to us as we travel through time. And so sometimes we talk about the slings and arrows of fate that people experience as they travel through their family life cycle. And then we know that sometimes when if the vertical axis is really loaded, as people travel along the horizontal axis, it doesn't always take a big thing for I always go like woof, like a big explosion or problem. So this is what we're thinking about. What's in a person's backpack of life that's been handed down vertically and that they've experienced horizontally. Okay, so a little example to make this a bit more concrete. So imagine that you are from a family that has very strong caring value. Your mother and grandmother were nurses, and as firstborn female in your family, this role of carer has been passed on to you, and you spend time at your family gatherings talking to others with a beautiful, empathic listening ear, hearing all their difficulties. And then let's imagine also in your backpack is that you work in an organization that's based on the medical model, and it sees problems and the need to fix problems. You love your job, and you often get praised about how caring you are and how helpful your ideas are to fix things. And then you go and learn solution focused brief therapy. And you learn that as a therapist, you take a step back and let the client find their own solutions, strengths, and resources. And then you're seeing a client and you're doing some wonderful SFBT, being curious and helpful, looking for solutions. And then the client is sharing a story with you about their medical difficulties, which is very problem saturated. And you find yourself thinking about all the problems you should be able to fix. And maybe that's a core framework. And you care about the person, and maybe that's your core value. And so the problem story starts to wobble your stance. You find yourself giving advice, telling the person what they should do next, telling them that they have received inadequate care for their medical issues. And so, while that might not necessarily be unhelpful, you've wobbled away from the solution focused stance. You've shifted off course. So, hopefully, that concrete example helps you see how the backpack of life, when it comes in with us and we're not conscious of it, can wobble us. But when we become conscious of it, we can pivot back to where we want to be. Thanks, Laura.
Thanks, Leonie. So,
Okay.
Leonie and I were having a big brainstorm about what makes us wobble from our solution focused stance. And these are some of the ideas we came up with. For me, it's definitely when the big problem saturated stories come into my conversations and I start to feel really stuck. Risk, when I start to be worried about risk and vulnerability, and I start to worry, oh, is my questions enough to manage these situations? When there's anxiety, when there's lots of pressure around the conversation that you're there to fix it and you need to go in there and do the work, or there's that real outcome focus. When things change, so for example, if you're doing your beautiful solution focus work, but then next thing you know, there's two parents in the room with you with your client, and it's kind of wobbled me, and I'm like, where do I start again? I've kind of lost my stance. It could be invitations to focus on that problem. Like I said, that medical model is big, particularly here in Australia, and it can invite us to look at those problems, the big problems, loss, trauma, health issues. They can get me a bit off track with being solution focused because I think I'm catching some of the anxiety that sits around those problems. When there's a rupture in the therapeutic relationship, so when things aren't going well in the session, sometimes I find that can wobble me off my stance, and the questions that I'm asking start to move from being curious to just try mending the relationship. Sometimes when you're not feeling confident as a therapist or you've got that edge of imposter syndrome, particularly I noticed that when I was first learning solution focused therapy, that I would get quite wobbly when I was feeling like I wasn't good enough. Feelings of hopelessness, feelings of aligning with the problem when you get stuck there. And sometimes, you know what? It's just when you're having a bad day as a therapist that you get a little wobbly off your stance. I'm sure lots of you have different examples of that. And so I'm encourage you to think about and reflect on what are the things that wobble your stance. So
Um, Laura, it's okay. I think someone just accidentally had their microphone off, but it's back on now. Sorry, that mute.
thank you. I love this quote by Elliot, and I wasn't even sure where to put it, so I just chucked it in where I thought would land. There's no way to be impressed by the hero unless we hear the problem that they go through. So the tragedy story, the trauma story, and the hero story are all the same story. It just depends how you listen. And I guess what we're talking about is how do we shift our listening ears with our stance on to help us see through some of that problem story and the trauma story to get to what we want to focus on. So, what can a wobble look like? When we're talking about this wobbly stance, you're like, what does that even look like? What we see it as is when we start giving advice rather than being curious. So, we've lost our stance. We're back on just giving advice. And Elliot talks about the moment you think they need this or the solution is, you're walking away from the solution focused stance and you're entering another zone. Again, not necessarily unhelpful, but when we're thinking about how we want to show up, it's about how we want to be more aware of what gets us off task. Sometimes feelings of being stuck and unsure what to do, when you get those thoughts as a therapist, it might mean that you're in a bit of a wobble from the solution focused stance. Sometimes it's when we start making assumptions, because we know that when we start making assumptions, we stop being curious. We stop asking those really rich description questions because we're just making assumptions of what's going on. When the therapist starts to lose hope or starts to worry and get anxiety, that can sometimes be the wobble. This idea of forcing solutions. So when we enter in conversations and we notice that we're trying to give people the solutions or ask really directive questions to get them to the solution we want them to do. That's a way of forcing solutions, which is not about how we stand as a solution focused practitioner. I went to a presentation early this morning by, I think it was Alyssa from Canada, and she was talking about how there's often big invitations to fast track therapy to get to the plan forward. And I think that's a really good example of that is often our clients are saying to us, what do we do? So you can be very quick to catch that invitation and offer a suggestion or a solution. Sometimes when we're wobbling, we're focusing too much on the problem and we're starting to ask too many questions about the problem. Sometimes it looks like talking too much, or for some people, it looks like talking too little or not asking questions. So these are just all examples of what a wobble can look like. And I guess I also want to mention the physical symptoms then can take over. I don't know if you've ever had this, but I get a beautiful red rash just coming up my neck when I get a little bit wobbly. Unfortunately, it's very visible, so people can often tell, but I notice it because I know that that's the moment where I need to do something differently because I can feel that red rash coming over me. The old clicking of the pen that can happen, or the fiddling. I'm a bit of an earring fiddler myself, so I often start to do this if I'm getting a little shaky and on shaky ground. Wheeling our foot, we might even feel our heart rate go up. Your watch might beep at you. Sometimes it's the opposite. Sometimes it's yawning. Sometimes it's that you feel suddenly really bored in the session. That could mean that you're in a bit of a wobbly moment where you've lost your stance and lost how you want to hold yourself. I am very, as you can tell with my hands and everything, I'm a very movement person. So I often notice too, I lean a little forward if I'm getting a little too involved and I'm right up in there. So sometimes I have to just take a minute to sit back a little. Or other people might sit back and that's the moment that catches their wobble. So we're all so individual in the way that we can notice these different wobbles and what they look like. So I'm going to encourage you to think back to a time when you might have felt a little bit stuck in session, that you might have felt a little bit wobbly on the ground. And I want you to think about what are some of your key signs that you might notice. So these might be thoughts that you have of, oh, I'm not good enough, or, oh, there's that problem, I need to talk more about it. Or it could even be those physical noticings that you have. But I want you just to have a little think, just silently, don't have to share with anyone, about what that looks like for you. And if you're not sure what that looks like, next time you're feeling a little stuck with a client, I really encourage you to do a bit of a body scan, a bit of a thought scan about what's going on for you in that moment. It's a great way to learn about ourselves, which helps us then be able to show up a lot better with our solution focused stance. Okay. We wanted to do a little bit of talking about the neuroscience behind what we're talking about, because this is like a bit of a new and growing area. And we think, Leonie and I think it sits really nicely when we're thinking about this stance and thinking about what's going on between people when we're trying to show up in the solution focused stance. So I'm going to pass it back to Leonie.
So we're just going to talk a little bit about how nervous systems, brains and nervous systems communicate to each other, and just to highlight the importance of us looking after our nervous system to hold our stance to create that contagious calm and hope. So if we flick over to the next slide, I just want to talk to you guys about a couple of little ideas. There's lots involved in this, but I want to talk about mirror neurons. And so, for people who haven't heard of mirror neurons, Google it up. It's a very cool story about how they were found. But it's this idea that we have some parts of our brain that feel what we see. And if you've ever been in a meeting and caught someone's yawn, or if you're in a meeting and they've gone out to take a sip of water and then you see yourself reaching for your drink bottle, or if you've ever been in a session and felt yourself catching your client's discouragement or anxiety, then this is what's at play because these mirror neurons are seeing what's happening, and then the same parts of your brain are lighting up. Now, the upside of this is that we can harness our mirror neurons for good. So while we're susceptible to other people's nervous systems, if we are attuned to ourselves and notice that and have some ways to regulate and get back into, a more thoughtful space where we're holding our stance, we then are showing that and sharing that for our clients to see and notice. So one way to describe that, this is from Eve Lipchick's book, is the term dual track awareness. So what this means is that while the two tracks are, we're paying attention to our conversation, and also we've got to monitor ourselves as well as our client and have that sort of connection to emotional and cognitive reactions. So the wobble tips that we're going to talk about, they're really going to help because of this idea that mirror neurons go both ways. And if you can be really aware of your science, you can consciously and intentionally really engage your resources. And then when you engage your resources, you maintain your therapeutic presence and you can hold that stance of hope. And that'll show in your face and it'll promote calm and belief. And that's what we want our clients to catch. I'm partial to a good quote. This is another favorite. This idea that because empathy is rooted in the body, the more mindful therapists are of their own somatic responses, the more skillfully they can choose to engage mirror neurons to give valuable information about a client's emotional state.
Thanks, Leonie. So, for us to be able to do that, there's three key things that we thought were really helpful when we're thinking about this. We want to show up in the solution focused stance with our hope, belief, and difference, but then we know that sometimes we wobble. So, what do we do with that? What do we do when we notice that red rash going on? So, we've kind of broken it down into 3 steps that we think would be really helpful. So, the first one is catch your stance. We want to identify that wobble, we want to identify what's going on for us. And then once we know about that stance, we want to try and reorientate. And we're going to talk through how we might do this. And then after we reorientate, we want to check in. We want to check in about how we're feeling, how it shifted the session, and what we're noticing, because then we might need to do some more tweaks moving forward. So I'm going to talk through each of these steps as we go through. So the first step we were talking about was we need to catch our stance. There's no way to shift a wobble if you don't even know that you're wobbling. So we wanted to kind of think about how we understand ourselves, all that stuff we've been talking about, the backpack of life, mirror neurons, the physical signs that we might be noticing. And we want to think about what's impacting us as therapists that's getting us wobbly. Leonie and I were talking about what's a good way to learn this stuff. I think reflection on practice is primary as a place to learn. So, thinking about not only what's happened in terms of the content of your session, but what has happened in your body throughout that session or in your thoughts throughout that session as well. So, trying to layer your reflection with these really intentional ways of looking at your stance. We've learnt that filming yourself, and I know that's cringy, but it's a really good way to learn when your solution focused stance wobbles because you can catch it so much better when you're watching it back. And of course, I love a good, great supervision moment where you can again keep unpacking how you understand the world, how you understand your clients, and what are these little trigger points that get you off course with your stance and how you want to show up. I've chucked in here just a couple of questions to start you on your journey of learning a bit more about yourself as a therapist. Like, obviously, we've been talking about the physical signs we can look out for, the thoughts we can look out for. I think this part is a little bit harder, and I've spent a lot of years unpacking this for myself in my own supervision. But we want to really understand our theory of change, what we believe from our worldview about what impacts our clients, how they create changes in their life. And I know we're here at a solution focused conference, and we really want to believe that solution focus is the key to unlock everything, and I do. But I also know that in my theory of change, I've got a fair chunk of the medical model in me. I'm also an OT, so I've got a whole lot of other stuff. And that's important for me to know because me knowing how theory of change works for me helps me identify when I have to do the dance with the solution focused stance in my session. So I've just popped this here, and I'll try and upload the slides or however we do that so you can have these at your disposal as well for later on reflection. So that's step number one. We want to identify the wobble. Step number two, we want to reorientate. And I've kind of put these words of being intentional, regulation, and pivoting if we need. So when I'm talking about intentionality, we're talking about staying focused. We're really being intentional about how we're showing up, what questions we're asking, that intentional listening. I love this idea about letting things go through to the keeper. If you've ever watched one of the masters of solution focus, Insu Kim Berg is one of them. She's so good at letting things go through to the keeper. So she's in a conversation, say she's doing the miracle question and doing a really great job at it, but then the client leaps back into problem talk. Insu just lets that go past her and then she asks another question to stay on track with the miracle question. It's so skillful, and I wish I had her skills in that. I hope one day I'll get there. But there's something about being intentional with what we let go and what we catch. So, intentionality, I think, is really important when we're trying to reorientate after a wobble. We're thinking about what do we need to catch, what do we need to let go through to the keeper. And I love this idea of the use of silence. I noticed there's another person talking a little bit about this, about the pace of therapy and pauses. I think it's so powerful. As therapists, I think what happens is we're so good at jumping in when things get awkward, the awkward silence, that little bit of tension that sits in the space. We're such helpers. We like quick to jump in on that. But sometimes being intentional with our silence creates space for something different. So I really encourage you to think about if you're trying to pivot back from a wobble, how do we use silence in a really intentional way? Use our pauses in a really intentional way. And I love this idea that sometimes questions don't need to be answered. You can just let a question hang. It doesn't need a response all the time. So another thing that we're thinking about, so with our reorientation, is we're intentional about what we're doing, but we're also trying to regulate. And this relates back to what Leonie was talking about with the mirror neurons. As a therapist, we need to get really good at regulating. And I know that some of us think we're really good at regulating, but I promise you, the more you look into this, to realize you're not as great as you thought. So when we become regulated, we can stay strong in our stance and we can keep leading with those curious questions and not jumping into problem solving or telling a person what to do. We all have our own triggers for regulation and becoming dysregulated. And again, these are some of the things that we need to think about when we're learning about us as therapists. So to do this, you might think back again to one of those sessions where it was wobbly. and have a think about what's going on for you with your regulation and take note of the context around that moment that you noticed that you got a bit dysregulated. It might be that there was a little trigger point in terms of the topic being discussed. It could be that there was a moment with the client and you in your dance with them that kind of got you off track and made a little bit of dysregulation and raised your anxiety a little bit. And like Leonie was saying, this is often from our backpack of life that we're carrying around unconsciously. When I was a new grad therapist, I thought I was the master of conflict smoothing. Conflict would walk into my therapy room and I could master that like no one's seen before. Clients would leave feeling super happy that they're not fighting anymore. And over time, what I learn is I'm a middle child in my own family of origin. And one of the roles in my family of origin is being the smoother of conflict. So that role was walking into me, into my therapy sessions. Once I started to learn that, I learned that sometimes families or people need to have a bit of conflict to hash some things out. Once I knew that, it meant that when conflict entered the therapy room, I had a choice to choose to regulate and then choose what I wanted to do with that moment rather than just kind of following along this idea of smoothing conflict. So, again, noticing when we get dysregulated is often a clue to what's going on for us. And once we know that, we can purposely regulate so we can get back on track. I'm going to upload this as well. This is just a bit of a tip sheet that I've put together, and Leonie's helped me as well about what we can do as therapists in these little micro regulation moments. So, when you're sitting with a client and you notice that you get wobbly or you get dysregulated, these are just some tips to help us get back and regulate and get back into our bodies. So, it could be as subtle as just pressing your fingertips together under your notebook or under the table. It could be that you wiggle your toes to kind of ground yourself again. It could be that I love to throw to the whiteboard when I get stuck and I start drawing because I find that that gives me a little bit of space to breathe again. So we just want to
Laura,
yeah.
sorry, can I interrupt? Someone's just asking if we can zoom in on it a bit because it's hard to
Oh,
read.
oh,
We'd definitely make this available as well. If you
yeah.
can't upload it on this site, look us up. We'll find a way.
Yeah, we'll find a way. Google me, I don't know, email me, we'll get it to you. Um, but yeah, these are just some examples. And again, you might have your own ways of doing things, but we just want to kind of pose some micro regulation moments. Sometimes when we think about regulation, we think about big moments like, oh, I need my favorite song. I need to have a bath and relax. Sometimes you can't do that because you're in the session with the client. So we have to find other ways to regulate. They're a little bit more subtle. So I hope that list sparks your creativity of what might work for you. And of course, you're welcome to use any of these tips as you go about your work as well. I've just put in that little box down there, other helpful tools. I just love, it's the OT in me. I love throwing to an activity or to a visual because it just gives me a little bit of space to think and reflect on my own. The other thing I've noticed, I've watched a few films of myself lately, and the other thing I do is I say to the client, tell me more. And while they're telling me more, I'm not necessarily listening, I'm regulating. And it just gives me a little bit of space to do something different with my own body. Okay, I'm going to try and zoom out or click something, but I promise you we'll try and get this to you. Okay. So we've done the intentional moment where we've intentionally listening, showing up. We've done the regulation moment, which means we have an opportunity to pivot a little bit. And I love this. We're just pivoting. We're not doing a full 360. We're just doing a little tweak. And so again, if we're thinking about we're in session with a client, we notice that we're off our solution focused stance. What's some ways that we can get back on track? And Elliot and Adam also give us a great list of things that we can do in terms of looking for what's meaningful for your client. I love this idea of meaningful because it means that we can get back to what the client is motivating for them, what they're passionate about, and it brings a bit more life into that session around strengths and resources. So, when we're thinking about pivoting, we're thinking about how do we get back onto the solution focused talk? How do we get back onto our hope and looking for that difference? But the first two parts of this are really important because to think like this and to think differently, we often have to be regulated. Otherwise, our brain isn't working well enough to get creative. Okay, so we've identified what's going on for us. We've done the regulation, we're intentional, we're pivoting. And now we're checking back in with ourselves. So once we've done the pivot, we want to make sure that has actually worked. So we want to do another little kind of scan in. Where are we at? Where's our thoughts? How stuck are we feeling? What's going on with our body? Do we need to regulate again? And I love this idea straight from Solution Focus Land. What is helpful? Let's do more of it. What is unhelpful? Let's do something different. So simple, but I think it also really applies to therapy. If we keep doing what we're doing and we keep getting stuck, it's not very helpful. But if you notice that actually throwing to the whiteboard actually is working, pivoting to an activity, looking for something meaningful is actually shifting things, we can do more of that in our session. And we might even overt the shift in the room with the client. We might say to them, hey, did you notice when we throw to the whiteboard, things change in this space? What do you notice about that? And so we're checking in with them as well about how they're finding the conversation going. So just to summarize that piece, our little wobble tips. One, catch the stance. Identify that you are actually wobbling. Two, we're reorientating, we're doing that regulation, we're being intentional, pivoting. And then three, we're checking in and noticing the shift and working out if we need to do more. I'm just aware of the time and I know I'm going quick, but we're almost there. So we've got this picture in there because I guess we're thinking about this stance and we're thinking about it as our superpower here, our superpower that sits underneath all our beautiful tools, questions, techniques. This, I think, is the piece that's like opens up you as a therapist to feel more free, get more creative in sessions, stick on that solution focused stance. Just before we go into discussion, because I know that we can get deep in that, I just want to point out Leonie and I are doing a 2 day training around Australia and New Zealand around solution focused therapy. And because we're solution focused therapists and we're family therapists, we've got a lot of this stuff in our program. So if you're interested to learn more, I encourage you to reach out with that as well. And I've also got our contact details. If you want to get in contact with us, we'd love to hear about it. And like I said, I will try and upload the resources onto the conference website.